once again, we are back on ttalk, Boond Soch, powered by Dr. V.N. Bereka Institute of Management and Ajmera. We try and invite prominent personalities on our show to have a conversation so that the target audience can enjoy meaningful learning out of it. Now, today we are covering as far as the cancer which are concerned, which is very alarming world over. When we talk in terms of global scenario, there are about 20 million cases every year as for the cancer which are concerned, and in India around about 1.4 million cases. Out of that, 9 lakh normally are the deaths which are being reported. Under this context, today on our ttalk program, Dr. Sanket Mehta. A brief introduction. Dr. Sanket Mehta is a very well known name in the country in the field of cytoreductive and HIPEC surgery, and also is the president of the Society of Peritoneal Surface Surgical Oncology of India and director of SSO Hospital in Mumbai. Dr. Sanket Mehta is also an alumni of Tata Memorial Center and is trained in France. Dr. Sanket Mehta, welcome to ttalk, Boond Soch, to this channel.
Thank you so much for
Thanks a lot for spending a valuable time. So now for the benefit of an target audience, like since 15 years, you have been there into the oncology practice and you have touched on 1,000 lives. Like, what made you to come to this field,
So, if I reflect back, I'm not very sure as to why I took up surgical oncology. I have vague memories of feeling that it's a challenging field of surgery, and we are definitely impacting lives in the true sense for which I entered medicine in the first place. But not very sure. I was perhaps not very mature when I selected the branch.
Mm-hmm.
But as I went into the field, I realized that there is so much more that we can do in the field of surgical oncology. It is also a very rapidly growing or rapidly evolving field where things evolve every decade.
Mm-hmm.
And the way we practice surgical oncology now is completely different from what we used to do when I was training. So that kind of dynamism is something which appealed to me, and that's why it's surgical oncology.
And what are the surgeries normally you more perform like?
So I specialize in GI and gynec malignancies, which includes a bulk of my work is cytoreductive surgery for advanced cancers which have spread to the peritoneum, what we call as peritoneal surface malignancies.
Mm-hmm.
I also deal with a lot of colorectal cancers and liver malignancies. It's in particular colorectal metastasis to the liver is peritoneal metastasis and liver metastasis are my field of specialty, where I specialize and do something different from what most surgical oncologists do, and of course the routine GI and gynec surgical work.
Since you have an association with Tata Memorial Hospital, also with Bridge Candy, also in the Reliance Hospital and Sefi Hospital, what made you go into the entrepreneurship drive as well as the SSO which is concerned? एक बुंद सोच की मतलब कहाँ से आए थे आपको ये हॉस्पिटल शुरू करना?
ये जो हॉस्पिटल शुरू करना था, that happened because of a real need. I was practicing in the corporate hospitals, Sefi, HN, Bridge Candy, and I was having a very successful and busy practice.
Mm-hmm.
But very soon I realized that I was become an elitist doctor, because for every patient that I could operate in one of these corporate hospitals, there were 4 others who could not afford it.
Mm-hmm.
Patients would come in the OPD, see me. I would know that I can make a real difference in the life of the patient. There was some of the surgeries were such that only a handful of surgeons can do. But when they would go to the corporate hospital to seek a budget, they would quietly disappear. Not because the disease was not operable, but because the budget was not. So it was a pain point. It was not something that I became a doctor for.
Okay.
And we started. Then I tried a few charitable hospitals to see if we can develop the activity in charitable hospitals. But those are setups which have a very low incentive for high complexity, high risk work. Partly because there is no financial drive to improve quality. And which is why we kind of failed there to take off complex surgeries. Simple surgeries are possible, but complex surgeries are not. And then eventually we I realized that the only way to do it was to have our own setup, which was, you know, at a quality where the patient feels that they are in a corporate hospital, but at a budget which was more friendly for the patient. And there would not be any luxury frills, but the setup would be capable enough to handle any complex surgery.
Good.
So that was the idea.
Uh-huh.
And we started this in the peak of COVID, unfortunately. And once we started working, we started with a very modest 16-bed setup. And within 4 months, we were running full. And then we realized that there was a real need in the market. So if you consider the demographics of urban India, we have around 12 to 15% of the population which are the rich class, who are either insured or are capable of affording the corporate hospitals for which all the big corporates are fighting. You have the 40% class which is, in the below poverty line, for whom you have the government hospitals and the charitable hospitals where they can get treatment under various government schemes. And then you have the vast middle class, for which 45 to 50% of the population, for which there is no organized healthcare setup that can cater to them. This is the backbone of urban India. This is the class of patients who are aspirational, who are growing, who are working hard. And patients in that field and that demographic of the society do not have good quality care available for them.
Dr. Sanket, I'm sure looking at 1.4 billion population in India which are concerned, still at the remote places, tier 2 and tier 3 cities, they lack this kind of facilities. I'm sure we are also going to show to our target audience the infra to what you're having at SSO . It's a great infrastructure to what we have seen. And doctor, it's normally as per as the expertise which are concerned on other ttalk platform, we'll try and talk more in terms of the technical and the soft aspects as the cancer which are concerned. Thank you very much for being part on this show. I'm sure as target audience, they'll get more insights in your following episodes which are going to get to. Thank you very much.
Thank you, sir.
Thanks.